You're turning 65. That doesn't make life any less groovy. But it is time to start thinking about Medicare. Whether you are working or not, Medicare coverage varies. Just because you're turning 65 doesn't mean the party is over. SHIBA's counselors can provide free, unbiased information so you can learn how Medicare will work for you. It's important to find the right fit for you. SHIBA's counselors can provide free, unbiased information so you can learn how Medicare will work for you without missing any deadlines. It's time to get the ball rolling on Medicare.
As we get older and think about retirement, this is what most of us see in our minds. But sometimes our reality is different from our dreams. My name is Lisa, and I want to tell you about my service learning project and the agency I worked for. SHIBA stands for Senior Health Insurance Benefits Advisors. It's a part of the State Health Insurance Program, or SHIP, located throughout the United States and is under the Department of Insurance. It's similar to the Apprise organization that you might be familiar with in Pennsylvania. I chose this organization because while searching for a project with the homeless, much information about homeless veterans kept popping up. At the time, I was studying Econ 310 and Ethics 300, and we had had many discussions about the experience of Medicare and Medicaid patients. In the process of looking for the right connection, SHIBA kept appearing. After reading the basics about the organization, I knew this is where I wanted to go to work. SHIBA is comprised of 11 paid employees throughout the state of Idaho and hundreds of volunteers. It works much the same way around the country. SHIBA does community training sessions, offers collaboration with the various other offices related to aging, and individual counseling about Medicare. They also do community outreach through pharmacies, doctor's offices, senior centers, community centers, and fairs. The employees and some volunteers do one-on-one counseling to help those approaching the age of 65 and those finding Medicare programs challenging after that age as well to navigate the very complicated choices available to seniors for health insurance. Many seniors find that they are ill-prepared for the expenses related to health care at this time in their lives. Most are unaware that there are safety nets available for these situations through the government. SHIBA is a place to go to find out about those things. Nurses wear a variety of hats throughout their careers and throughout their community. It is my hope that nurses will see a role in addressing the needs of seniors in any of the many aspects available to volunteer. I found a small way to contribute through community outreach. By delivering information to assist seniors in making appropriate decisions about their Medicare, and speaking with people at pharmacies, senior citizens agencies, and disability fairs, I was able to meet my service learning project objectives and help a few seniors along the way to find the best fit for them to have the healthiest and least stress-filled retirement possible. By advocating for seniors with government representatives, through volunteering at agencies who offer blood pressure checks, vaccinations, and flu shots to seniors, and by directing seniors to organizations such as Meals on Wheels, activities through the Office of Aging, and by helping those with medical problems locate and access the affordable care needed, nurses play a vital role. Initially, I had hoped to work as a Medicare counselor, not realizing the complexity of that position. After applying to be a volunteer, I did the online training and awaited a call from the office. Through a series of emails, I was able to get a face-to-face interview with Angie Mackin, the director of the SHIBA North Idaho Territory. She and 2 other paid employees man that office, utilizing volunteers in a variety of ways. She interviewed me at a small cafe in Sandpoint, Idaho, while there to do a presentation on SeniorNet for the Geezer Forum of Sandpoint. It's a funny name, I know, but it is serious business. These are a group of men and women who advocate for and work to provide quality and relevant information to and about veterans organizations, senior living services, hospital social services, the Agency on Aging, Hospice of North Idaho, and the senior centers available in all local communities. From then on, I was hooked. Seniors today are vital, intelligent, savvy people who are capable of many contributions within their communities. Many of the volunteers within these organizations are seniors who were advised and assisted by people like Angie Mackin and are now paying it forward. Volunteers like me do online training followed by online testing to demonstrate our acquisition of knowledge, and then we're able to disseminate information about needed services to the public. I should point out, while these two women have no medical background, they have taken it upon themselves to become well-versed in all things medical. As I mentioned initially, I had my sights set on being a direct Medicare advisor. This, I discovered, took far too long to master in order to complete for my service learning project. Those who do this are well trained for many months and hundreds of hours before embarking on the journey. Angie was not dissuaded, however, from using my help. She assisted me in developing goals and identifying areas that I could be involved with. It was just amazing to watch her work with seniors. They would come into her office feeling hopeless and fearful, but leave with applications already filled out for needed assistance. Some of those areas of assistance are prescription drug payments, food delivery assistance, and utility payments. Anything you can think of, really. There are times when seniors lose their spouse and do not realize how difficult it will be to make it on one's Social Security check. Lives can be devastated and ruined in more ways than they realize. There is help, but finding it is not easy. Angie Mackin makes it look that way, though. What I do see as a real and necessary step for healthcare professionals is advocacy to our government representatives. These programs and resources need to be made simpler and more accessible. Nobody should work and contribute to Social Security and Medicare their entire lives only to be relegated to an impoverished existence when they no longer are able to work. These are the objectives that I set for myself with my service learning project. However, in the future, I hope to give a voice to seniors living in the state of Idaho by making and maintaining contact with state and federal representatives to show them what our aging population needs. I think sometimes we all need to be reminded that we're going to find ourselves in this situation one day, and we all hope the system will be a little more streamlined. My first objective was that by the end of my service learning project, I would become adequately trained to appropriately direct those senior citizens needing assistance to get signed up for coverage through Medicare. This goal was met through the training online and attended in person. While I was not a direct advisor, I was able to speak to many seniors about their specific situations and direct them to Angie or another community service agency that would be able to address their specific needs. My second goal was that by the end of my service learning project, I would have assessed the needs of at least 5 senior citizens. I began this project in early May and actually did not have contact with seniors until June. Often seniors will ask questions rather than give direct information, and I think that's because they feel a sense of guilt or shame about having financial difficulties. This particular goal was easily accomplished on the first delivery that I made of information to a senior center. Several seniors had questions about whether or not Medicare offered assistance with things like food and housekeeping. Along with sitting and talking to them, I provided information in written form, but mostly I directed them to SHIBA. By the time I was given the opportunity to man my own booth at the Disability Fair in August, I had spoken with and helped to direct more than 20 seniors directly and countless seniors through literature disseminated. My third objective is that by the end of my service learning project, I would assist at least 5 senior citizens with signing up for Medicare by making appropriate referrals. Between June and August, this objective was met primarily through community outreach. I began with Angie when she counseled several seniors from a variety of backgrounds about various aspects of assistance available to them. Over the course of our time together, I observed several counselors who met with a variety of seniors. There was a veteran of the armed forces, a woman who had lost her husband and half of his Social Security benefits, all while in treatment for kidney failure, and a blind gentleman approaching the age when it would become necessary for him to transition from Medicare for those over 65 years of age, to name just a few. These are just some examples of the bumps in the road that these seniors experience. Until they found themselves in a certain position, many had never considered that these things could happen to them. The gentleman who was blind from macular degeneration was that way from the time he was 23 years old, and he had no idea that you needed to sign up for Medicare when you reached the age of 65. He was already on Medicare. The woman who lost her husband assumed his checks would keep coming, never realizing it would be cut in half when her needs were at their greatest. The veteran didn't understand that veteran services are different for each member of the military based on a variety of factors that even these trained counselors do not fully understand. So those people are always directed back to the Office for Veterans Affairs, where their information is entered into a computer program, and this is what lets them know what's available to them. These next 3 slides are from the fair that I worked at as a representative for SHIBA. This is the table where my flyers and information were made available to everybody. As you can see, we're in a beautiful park by the lake, and our host is the Office of Disability Services. They provided lunch and entertainment for the day for the entire community and everybody's children. I hope you can see this picture. I'm not a very good photographer, but this was our MC for the day. He's a local radio personality. It was really a fun time. From my perspective as a primary care clinic nurse, I have a renewed understanding of the varying and complicated problems that this population deals with every day. Personally, it impressed upon me the need to recognize the challenge that everyone deals with and work to understand and assist seniors in locating needed services at every aspect of my career. This is just a picture of the beautiful environment these seniors get to experience daily if they are the fortunate ones who remain vital and healthy. This project made a lasting impression on me and reminded me to encourage fellow students and community leaders to continue to work toward meeting the needs of our seniors. I hope you found this presentation to be interesting and enjoyable, and I thank you for watching.
When I get older, losing my hair, many years from now, will you still be sending me a Valentine, birthday greetings, bottle of wine? If I'd been out till 2:45, would you lock the door? Will you still need me? Will you still feed me when I'm 64?